Welcome back, everybody, for the last episode of the year. This is the Podiatric Dermatology monthly wrap-up, and you're joined by myself, Joseph Frankel, and my lovely co-host, Steph Finlayson. Welcome.
Hello, everybody. Thank you for joining us.
Yes, what has been happening in your world?
I can hear those sleigh bells ringing.
The Hanukkah candles are lighting. Yes, either way.
Fabulous. We're so close.
Yes.
We've gotten through another year. We
Yes.
are so close to that finish line.
We can smell the cake and the donuts brewing right now.
Oh.
Okay, so today we've got a wound focus. We're gonna wound things up for the year. Poor grammar right there. I know.
No.
Hopefully I'll come back with a better joke bag. I'll ask Santa for some.
Oh, you definitely need to ask Santa. I'll ask Santa for better jokes for you.
Yes.
I'll forego my Christmas presents so that you can get better dad jokes.
Well, 'tis the season of giving. So as we move forward, we're talking about wound and a physiological focus. So lots of P's and F's in there. Steph, what is a wound?
A wound, a giant hole,
Yes,
a breach of tissue.
It is. And wounds can happen inside and outside, correct?
Correct.
I mean,
don't really want ones on the inside. I mean, sometimes you don't want ones on the outside either. But...
Yeah, correct. I mean, if we think about, let's say, a stomach ulcer, right? That's a wound. So a wound is any type of tissue injury where we've got a number of stages and a number of changes.
Yeah.
So a good mnemonic to remember the stages of wound healing, Steph, that we were talking about in the prep for this episode.
Herp.
Herp.
It's lovely.
With an I, not with an E.
With an so it's kind of like herp.
Herp. It does sound a bit Scottish. I did check. Yes, and speaking of wounds, I did check out the epic Mel Gibson movie from the 90s, Braveheart. There were plenty of wounds happening.
Lots of wounds in there. I'm such a sook. I still can't watch the end scene.
No.
I can't do it. Yeah.
It's tough.
So I don't know how. I know he dies. I've never seen it happen. Can't do it.
Yes. Well, they'll never take away the ending or your freedom.
Oh, no.
Yeah,
Stop.
But the music is lovely. It's absolutely lovely. But we're massively digressing
Joseph,
now. Yes.
What does HERP stand for? Let me guess. Let's see if I remember this.
Okay.
Hemostasis.
Well done. What does that mean?
Stopping of blood.
Well done.
No. Well, not stopping, but leveling. So stasis being balance.
Correct.
Right?
Correct. Right. Stasis, balance, cessation.
Yes.
So
hemostasis, so the stopping of the flowing of the blood.
That's number one.
And then we have inflammatory.
Good.
Right. So all of the blood's little helpers being sent down to help with that inflammation process.
Yes. And with the inflammatory process comes swelling, because swelling is one of the cardinal signs of inflammation, and it is there to create room for cells to move in between the tissues. If you don't have room, the cells can't get there. And if the cells can't get there, they can't get up to the RUP phase.
The what? The RUP?
The RUP phase.
I thought you'd had a little moment there. Okay.
HERP.
Remodeling.
Correct. What does that mean? It has nothing to do with a catwalk.
It's kind of like renovating, right?
100% right, which we had a few months ago at work, and the painters at work that were doing the painting, I don't know what was worse, the smell of their cigarette smoke or the smell of the paint.
Oh, terrible.
Delicious.
Hope you don't have the smell of cigarettes embedded in the paint, because that would be lovely.
Mercifully not. It's now all fresh and white and clean for now.
Wonderful.
And P, finally?
P, proliferation.
Well done. So that's where, if we can broadly categorize it in terms of its macro events, phase number one, hemostasis, is the scab. Phase number two, inflammation, is the redness and the swelling of tissue. Stage number three is granulation tissue, which is proud flesh, this beefy red kind of skin.
Did you have to say beefy?
Okay, sorry.
Did you?
Well, 'tis the season.
Why do we always talk about food and feet?
Because you should see my phone. Like, my phone has literally three things. It's got pictures of gross foot stuff, my kids, and food. So I just go there, okay? Genuinely. And Steph, you know that. Like, that's
I know.
The photos that we share, it's literally.
We've all had those moments at dinner of going, did I show you this? And then you search for like meat and it's a foot wound.
Right. That's right. And everyone's like, I know, it's funny. here's a bit of personal banter between Steph and I for those viewers that want to know a little bit about what Steph and I talk about outside
wounds. It's
of
always
this.
wounds.
Well, it's not just wounds. It's me sending Steph a photo of like shawarma, and then like she'll go, "Oh, that's awesome. By the way, look at
it looks like this wound that I saw today."
Exactly,
because we're disgusting.
Yeah, Steph and I have a lot of fun. Okay, but if we can circle back to the first point of hemostasis, so a wound by definition has to involve some sort of vascular component. So if it ain't bleeding, it ain't a wound. So if you remember a couple of episodes ago, we spoke about exfoliative keratolysis. That's not a wound, right? And where things start to get a little bit curious and quirky is when we start to overlap wound healing with dermatology. And so there's one condition I can think of that is a dermatosis that has a wound component. Can you think of it off the top of your head? Well, actually, there's a number of them, but there's one in particular that happens around the ankles. Have you ever had a malleolus wound, a lateral ankle wound?
Like a horrible venous ulcer or an arterial ulceration.
Yep. Sometimes venous, sometimes it's something else, but it's just, it's annoying. And often what it can be is something called lichen simplex chronicus.
Ooh.
Yes. And let me see if I can find a photo for the viewers. No, we are skipping past that one. And we are hopefully going to full screen mode. It's always good when you have, there you go.
Skip.
What does that look like to you?
Yeah, like a little punched out ulcer.
Yep. So it's not an arterial ulcer. It's not a venous ulcer.
No, it doesn't look drastic enough to be either of those, really.
No, and it's not the type of photo you'd share with me after I sent you a schnitzel photo.
That would be no, try again.
That's right. Maybe a chicken nugget.
That is not impressive.
No, that's right. You need
Send me a better one.
You need to match the sandwich with the wound. So this is lichen simplex chronicus is essentially a tissue reaction where you get an erosion and a thickening. Lichenification means to mossify something.
Yes.
So what happens is that
so like a plaque.
Yeah, it's sort of. I mean, the tissue just doesn't behave normally, but. I mean, wound healing is essentially a subset of dermatology. So when we think about eczema, when we think about psoriasis, when we think about surgery, I mean, all of these elements have wound healing within it. But often it's almost like we've sort of, we box things in medicine. It's like, oh, well, this belongs to wound healing and this belongs to dermatology and this belongs to musculoskeletal therapies. But there is certainly an overlap between the two. And what's interesting is if we think a little bit further and we think about what tissue actually does during wound healing. I mean, so we said that there was the remodeling phase and the inflammatory phase. But why do wounds get stuck? Why do you think wounds just get stuck in one of those phases, Steph? What's going on there?
Oh, lots of different reasons, really. So, I mean, if you don't have an adequate blood supply, you're not going to be able to move through those particular phases. If you've got too much pressure going through, then you're not going to be able to remodel. Lots of different reasons.
Diabetes as well. I mean, diabetes fundamentally changes the cell structures, the inflammatory responses. Diabetes does lots of interesting things. It changes things on a macro and on a micro level. So I find that, I mean, I don't know whether this is your experience, the wounds can kind of get stuck somewhere in between the inflammatory and the remodeling phase. Do you find that? I
find also that they bounce around. So, you might get it going back to an inflammatory stage if you've had an infection happening and then you've got to start again, or if you've had a patient who's almost been healed and then they go to a wedding and don't wear their offloading shoes and then they're suddenly back at the remodeling phase. Or and
you raise an interesting point, and part of the wound healing continuum is actually bringing the wound back to an acute phase. And that's where things like debridement can be really effective. We can fundamentally change the way the tissue works. We can sort of push it backwards to sort of re-stimulate healing and go, right, what are we actually trying to achieve here? But there's a number of other products that we can use, particularly that don't always come in second place, but they come in first place. What do you think I'm referring to, Steph?
I have no idea what you're talking about.
Well, when someone comes in second place at the Olympics, what are they awarded, Steph?
A silver medal. Oh
Yes,
God,
I
why did you
know
do
it's
that to
terrible.
me?
I'm sorry. It's
Mean.
yes, it's late at night or early in the morning, depending on wherever you're listening to it. But you know, the things do deteriorate. So silver, are you a fan?
Mm.
Is it your number one or is it your number
See, this
two?
is a bit controversial now because I actually am a fan of silver, but it's been getting a bit of a bad rap lately.
Yeah, I mean, I need to look into the literature a little bit further, but there was a recent review that implied that it wasn't great on granulation tissue, and you know, classically we've used silver in two ways. We've either used it as an escharotic, so something that basically mimics the first part of wound
Scabs it
healing,
up.
scabs it up, yeah. An
Hmm.
eschar is another name for a scab, but we've also used it as in an antimicrobial capacity, and it was the
Mm.
flavor of the month probably what, about 10, 15 years ago, maybe more. Maybe
So you're
more.
saying I'm dated?
No, I'm saying your classic Steph. That's what I'm saying.
Oh, very nice recovery. Well done.
Yes, yeah, and you're definitely not as old as me, as I've got plenty of silver in my beard, as the viewers can see. But
I think if I had a beard, it would be silvery as well, so it's
well,
fine.
yeah, absolutely. But I mean, thinking of silver, speaking of silver again. So, in terms of dressings, what forms does it come in that you can think of off the top of
Uh,
your head?
Foams. So
Yep,
silver embedded foam dressing
yep,
is one of my favorites.
yep.
You can get, I'm trying not to name brands, but you can get sort of, fibers with embedded
Yes,
silver in there.
absolutely.
And also, nice little sort of sheets of silver as
There was a
well.
cream that was very popular. There was a cream specific for
Ah.
burns that was quite popular a couple of years back.
Oh, okay.
Quite popular a
Mm.
couple of years back, yeah. But the other form that silver comes in, which we mentioned previously, in terms of an escharotic, is silver nitrate. And that can come in a liquid or a stick. And I've had some bad experiences with it. And so what's happened is it's actually scabbed up and sealed in microbes.
Ah,
Even though it's inherently antimicrobial, it can, when you form an unnatural eschar, when you form an unnatural scab, it can seal tissue in. And that's
yeah.
where things can get a little bit interesting. And I do recall you mentioning to me previously that there was some warning that you saw with silver that, caution needed to be taken.
Yeah, there was something recently that came out where it was sort of, about sort of more
Mm,
heavily monitoring your use of silver nitrate and making sure that you're recording it in correct ways, just in case you get those adverse reactions, which are
mm.
they are quite rare, but we need
True,
to be
true.
aware of that.
Absolutely. And I think when it comes to any wound, monitoring is key. Can you think of other antimicrobials off the top of your head that you like to use in wound care?
Oh, a bit of betadine, iodine.
Yeah, iodine's good. Iodine's
Mm.
good. I mean, what's interesting is I recently heard that we still haven't developed resistance to iodine, which is
Oh,
really powerful in terms of antimicrobial and antibiotic stewardship. More recently, we're now seeing evidence of terbinafine and azole resistant strains of fungus. So iodine, it is a gold color. So maybe that's why.
maybe that's our gold.
Well, and also interestingly, I do recall copper actually also having some antimicrobial properties. So, maybe we
Yes, I've
need
heard
to
that too. Yeah.
chuck everything at the podium. But
So
yeah.
we'll just, grab whatever metal we can and stick it all
Absolutely.
in.
Just, chuck a bit of
Just
aluminum
keep
on it or something,
trying.
titanium. There's all sorts of stuff out there, yeah. But I think silver certainly has its place, and I think when it comes to wound dressings, unless it's genuinely been found to be dangerous or deleterious in some sort of way, I mean, evidence-based medicine is really it. The key is the B word. It's based in evidence. It doesn't mean that every single decision you make has to have the absolute best evidence on everything.
Yeah.
I mean, if you think back to the warts episode that we aired a couple of months ago, you'd notice that the evidence for a lot of the treatments were all over the shop. So it's
Yes. And I think, you and I had a little discussion about this a little while ago that just because something is gold standard doesn't mean that it is the correct choice for your patient.
absolutely right.
And
Absolutely
so
right.
you need to, have that toolbox of available treatments and
Yeah.
think, well, I've exhausted this option, this option, this option.
Yeah.
perhaps I go to something that's, you know, a
Yeah.
little further down the list.
Mm.
I've certainly had more chronic wounds that have stagnated, and then I've sort of intervened with some silver, and have had patients who, you know, have had chronic wounds and will say to me, Steph, it did so much better when I was on the silver foam. And
Mm.
I'll say, okay, well, let's try it again. And then it gets smaller again. So,
Right.
you know, whilst the evidence is not fantastic, you know, anecdotally, sometimes it
Mm.
works for some people. And so
Right.
you kind of still need to have those options up your sleeve.
Absolutely. Absolutely. You know, and anything that we can add to the toolkit when it comes to dealing with wounds. And I've seen some great emerging evidence on looking at specific supplements, you know, that work well, things like zinc, vitamin C, vitamin D.
Mm-hmm.
So, you know, we're just at the infancy with a lot of these treatments, but
Not
you
to
know,
say anything about nutrition and
ah,
diet is
that's
a huge aspect
massive,
of wound care. Yeah.
massive, massive. I mean, even do you remember when the use of amino acids like arginine were really popular? Do you remember that?
Yeah.
I mean, amino acids are essentially just building blocks of protein. So by getting adequate nutritional protein, you can effectively, you know, negate the need for a specific supplement. But
Yeah.
that is to say, you just need enough. You know, you need proteins not just for bodybuilders.
Absolutely. It's just so difficult sometimes to get those, you know, patients with chronic wounds to look at nutrition, because often, you know, they have chronic wounds because they have several chronic diseases. They're exhausted. They've got, you know, appointment fatigue. They're seeing you, they're seeing an endocrinologist. If they're diabetic, they're seeing an endo. They're, you know, often referred to ortho or vascular or all these kind of interventions that need to be looked at for chronic wounds. You know, the last thing they want is another referral to another specialist to talk about something else that they have to put on their list of things to do. But it's very important. So it's good that as a podiatrist, you can point them in the right direction for things like that, as a little gentle nudge towards, you know, what's your diet like? How is that? You
Absolutely.
know, that little level of secondary questioning is really important sometimes
Mm.
when you're dealing with chronic wounds.
Appointment fatigue. That is a term that I've never heard.
Oh, really?
I mean, I've heard of lots of other fatigues, but appointment fatigue, that is a new one. Thank you.
Well, there you go.
I will use that today. And you know what? That makes sense, because if you've got a chronic disease, you're going to end up seeing, I mean, essentially your medical team will probably, you'll be seeing them more than some of your family and friends,
Oh, you know,
which
I have my patients will come in and say, you know, I'm busier now than when I was working full time. And it's
that's,
literally just because I'm seeing like 7 specialists in the next 3 weeks, and I've got to go to this hospital and that one and that one. And then it starts this, and then I have to go and get this imaging done before I can see this specialist. And they're just exhausted, you know, oftentimes they won't show up, and that's okay because they've just had enough.
it's a full-time job looking after a chronic disease. It really is,
It
you know,
really is.
and
It's
it really is
exhausting.
exhausting. Yeah.
Mm.
Okay, well, to wound things up, have we missed anything else? We
Yeah, I
were,
think you completely skipped over what we
we
were going to
did,
discuss with
yes.
hyperplasia and hypertrophy
We
and the
were
difference
going to
between
talk about
those.
yeah, we were going to talk about that. We can leave that for another episode, but essentially what we're going to talk about is the difference between tissue that gets bigger, so the actual cells get bigger, or whether the tissues, the cells themselves turn over more rapidly. So there's a number of dermatoses that are related to those. Warts is one example where it's somewhere between the two, and then you can get in terms of edematous and lymphodematous conditions and vascular conditions, you can get things like verrucous hyperplasia, where you get these sort of, and we see particularly in amputation sites. So you can feel free to look that up in preparation for another episode. But I feel that kind of needs its own little discussion there. And
I
we
feel
will,
like that's almost an episode in and of itself.
well, I mean, like so much, we do try to condense things to leave ourselves more room for other stuff, but also because, you know, there's so much to cover, and it's good to just focus just on one little topic at a time. Take it one wound at a time. You know? Yeah. All right. Well, I think that about wraps it up for today. Stephanie, final thoughts for 2023?
Oh my goodness, what a year. I just, yeah, hope that you're all getting the rest that you need. I know, you know, December time in podiatry is crazy busy for so many of us. Everybody, you know, it's like poor, you know, hairdressers and podiatrists don't talk to them at Christmas time, right? Everybody wants their feet done and their hair done before they go anywhere.
I know there's this psychological barrier. It's like, I'm here on the 27th of December. No, I need it done by the 24th.
Yeah, unreal.
Yeah.
So just hang in there, everyone. You've done beautiful work this week and this decade,
this
entire year. So, I hope you managed to get some time with your families and enjoy yourselves and, refreshed and recharged, ready for 2024. Goodness me.
Absolutely. And what a perfect way to end things off. Steph, pleasure as always. Thank you so much for putting up with me for the year. And
I'm going to ask Santa for an improvement to your dad jokes. So
yes,
definitely on my list.
Absolutely. And hopefully I've been a good enough boy to receive that. Well, wishing everyone a happy holidays, whatever you're celebrating.
Happy holiday season, indeed.
Lots of health and happiness and togetherness and unity and peace in the world. And we will be back next year, bigger, bolder, and with more
terrible jokes.
With more terrible jokes and with more skin conditions. And if you ever want to get in touch with us, you can drop us a comment down below, either on Spotify, YouTube, and you're very welcome to join our Facebook group, Podiatric Dermatology Interest Group. I'm Joseph. This is Steph. Thanks for everything, everyone.
Thank you. Happy holidays.